I am haunted by moments. There's always been an air of the paranormal around hospice and palliative end-of-life care, but those stories are best left for cold autumn nights when only a sliver of moon hangs in the sky. Like any good hospice nurse, I have ghost stories about my work. However, the moments I'm haunted by are more mundane and have much more bearing on my practice than ghosts and deathbed visions. In school, hospice palliative care was often relegated to a single paragraph and sometimes a single sentence at the end of a textbook chapter, an afterthought to the pathology of a disease and a curative approach to care. The idea of people dying flits like a ghost at the edges of our awareness, a dark shadow glimpsed out of the corner of your eye. You know it's there, waiting, and yet still somehow convince yourself that if you ignore it, it'll go away. In the words of my favorite philosopher, Philip J. Fry, thanks to denial, I'm immortal. I have no illusions about the nature of my work. Death here follows me from room to room. It whispers to me that I should go check that patient at the end of the hall, that I should have a difficult conversation about what the next few days, hours, minutes, seconds will look like. It reminds me to take delight and gratitude in the small things, however fleeting. There's a kind of freedom in acknowledging a finite end and resolving to make the most of it. Death, however, doesn't haunt me. Moments do. Of course, there are the times when I messed up, said the wrong thing, didn't chart properly, made a medication error, the kinds of hauntings that keep me up at 3 a.m., ruminating on what I could have said or done differently, reliving them over and over because my brain thinks that causing me guilt in the present will totally help with these situations long since past. How do you respond to someone who is panicking as their sister is moments away from death, who, because they feel so powerless, implores you to do something because, can't you see she's suffering? How do you support a mother and daughter who, though they'd been prepared for the possibility, were present during a palliative emergency when their husband and father bled out? And what do you say to them as they're steeling themselves for his imminent death, only for him to continue living almost half a day after the event? How can I tell someone who is bedbound with a brain tumor that, no, you can't go home? However, there are ghosts of another variety that drift through my thoughts. The remembrance of a squeezed hand during a dressing change. I told her she could swear if she wanted to that it might help get through the pain of removing bandages. She promptly dropped a loud, "Fuck!" and turned to me with a grin. Did that make it easier for you? Getting my butt pinched by a spry and twinkly-eyed 98-year-old lady, I made the mistake of turning my back on her, as so many of the nurses did. Only half-jokingly telling patients and families that the liquor was in the medication room under the sink. Full disclosure, the liquor belonged to the patients, and I swear I didn't touch any of it. The immediate embarrassment at hearing the words, "It wouldn't kill you to take your meds," spill from my lips. And the instant relief as the veteran started laughing and threw his pills in his mouth. Helping a grown daughter get silver-inked handprints from her now-deceased mother. Crying with a grieving mother who had just lost a son younger than I was. Having a patient ask to just sit with me. A few stolen seconds here and there from my daily perfunctory tasks where I could make a brief but deep connection with those in my care, where I could meet them person to person and be present with them in their last days, hours, minutes, and seconds. I am haunted by moments, and I am grateful for them. Thank you.